Accepted. 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 Access denied. Access denied. Accepted. Access denied. Accepted. 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 Access denied. Accepted. 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 Accepted.
The other day I have discussed about larynx. You know, larynx is the larynx consists of the laryngeal skeleton of larynx. Skeleton of larynx consists of some cartilages, some muscles, some membrane, and joints. They actually comprise larynx. Right? Now, only some important aspect I will discuss. Some important aspect which is very easy to understand. Right? There are 9 cartilages. 9 cartilages and there are 9 intrinsic muscles. You should remember 9 cartilage and 9 intrinsic muscles. Right? What are the 9 cartilages? The other day I have discussed.
3 paired and 3 unpaired.
Huh.
The thyroid cartilage, the cricoid cartilage, the unpaired. Thyroid cartilage, cricoid cartilage,
Cricoid, thyroid.
and the epiglottis.
Huh.
The unpaired is the cuneiform, tunicate,
Corniculate,
corniculate, cuneiform, and
arytenoid.
arytenoid.
This is the classification. And now, as per histology, sometimes it may come as a short note. Then you have to write this, and then you have to write the histologically how it is. Histologically, most are hyaline cartilage, except there are some elastic cartilage. First of all, you should mention elastic cartilage, that is corniculate, cuneiform, and epiglottis. Corniculate, cuneiform, epiglottis, plus apex and vocal process of arytenoid cartilage, they are elastic cartilage, and rest is hyaline cartilage. তাহলে হলো তো একটা শর্ট একটু বলে হবে। Now there are intrinsic muscles and extrinsic muscles. Out of these intrinsic muscles, you should divide it into muscles, adductor muscles of the larynx, abductor muscles of the larynx, and muscles acting on the inlet of the larynx. So if you count, there are also 9 muscles, 9 cartilages, 9 muscles. It's easy to remember. Now I have told you one important muscle in our body. Most important muscle in our body is, what is the name of that muscle? Important muscles in our body. কি পড়ছো? টাং। কিন্তু টাং পড়ছে, ফালতু বকা হচ্ছে, বুঝলি? If that muscle doesn't act, your vocal cord will approximate each other. That means it abducts. That means the abductor of the vocal cord. Only one muscle is abductor. What is that? That is posterior cricoarytenoid. By the name you can understand from where to where it is going. Cricoarytenoid. One means cricoid se arytenoid ja raha hai. From the posterior aspect of the cricoid cartilage takes origin, and it is going to the muscular process of the arytenoid cartilage. Posterior aspect of the muscular process of the arytenoid cartilage. This is most important muscle. This muscle comes as a short note. First of all, you should write its origin, insertion, nerve supply, and action. Nerve supply is, all muscles of larynx. It is very easy to remember. All intrinsic muscles of larynx are supplied by recurrent laryngeal nerve, except one muscle. That is it is found anteriorly. It is going from the cricoid to the thyroid, cricothyroid. The vagus nerve, branch of the vagus nerve, superior laryngeal and recurrent laryngeal. As it is related to laryngeal, so it must go to larynx. From these two nerves, whole larynx will be supplied, both sensory and motor. Superior laryngeal nerve It divides into two, internal and external. Internal means it will go inside. How it will go inside? After piercing the thyroid membrane. After piercing the thyroid membrane, along with this another artery also pierce, that is called superior laryngeal artery. That superior laryngeal artery branch of the superior thyroid artery. They are jointly piercing the thyroid membrane, and it is supplied the sensory supply of the mucous membrane above the vocal fold. Above the vocal fold. Sensory supply above the vocal fold is by internal laryngeal nerve. It is coming from where? It is coming from superior laryngeal nerve. Superior laryngeal nerve is the branch of vagus nerve. Other division, that is external laryngeal nerve, will go and supply the muscle. That is from cricoid to cricothyroid. Cricothyroid muscle is the tensor muscle of the vocal cord. If that is paralyzed, tension will be released. It will be loose, lax, and there will be, your voice will be to some extent down. Right? Now, another branch of the vagus is called recurrent laryngeal nerve. What is the meaning of the recurrent? Going back, যেখান থেকে আসছিল আবার সেখানে চলে যাচ্ছে আর কি। So, recurrent laryngeal nerve, the course of recurrent laryngeal nerve is different, right and left. You know, left recurrent nerve actually hooks. Which artery it hooks? Arch of aorta, very good. So that is lies within the thorax, superior mediastinum. And right recurrent laryngeal nerve hooks right subclavian artery. So it lies at the root of the neck. Right? It is very important. One right at the root of the neck and one lies superior mediastinum of the superior mediastinum. Now, this recurrent laryngeal nerve is important because it supplies all the muscles of the larynx except cricothyroid. I have already told that cricothyroid is supplied by external laryngeal nerve, that is a branch of the superior laryngeal nerve, and superior laryngeal nerve is a branch of the vagus nerve. Now supply of the mucous membrane, that is sensory supply. Sensory supply below the vocal cord is by the recurrent laryngeal nerve. So recurrent laryngeal nerve actually supplying a wide area, all the muscles except cricothyroid plus sensory supply below the vocal cord. Above the vocal cord, the sensory supply is from internal laryngeal nerve. মনে থাকবে? Now what is vocal cord? Vocal cord, from where vocal cord has come. What is it? Vocal cord. If you see, কখনো ইএনটিকে দেখাতে গেছিলিস? ইএনটি স্পেশালিস্টের কাছে কখনো গেছিলিস? হাসপাতালে ইএনটি স্পেশালিস্টকে দেখেছিস? মাথায় একটা থাকে বেল্ট, একটা আয়না থাকে, আয়নার থ্রু দিয়ে দেখে, আর একটা হাতে একটা থাকে ল্যারিঞ্জিয়াল মিরার, এমনি করে গলায় দেখবে, গলায় ভরে দেখছি। আর ল্যারিঞ্জিয়াল মিরারটা ওটা হচ্ছে ইনডাইরেক্টলি একটা ছবি ওখানে দেখতে পাই, এমনি করে ভেতরে ঢুকিয়ে দেখবে আর কি, বুঝলি তো? মানে ও দেখে দা ল্যারিংস, ইনলেট অফ ল্যারিংস, বুঝতে পারলি? ইনলেট অফ ল্যারিংস। নাও if you see inside the larynx, you may see either indirectly or directly by laryngoscope. There you will find three folds. One is called epiglottic fold, one is called vestibular fold, Another is just below the vestibular fold, there is vocal fold. You will find 3 folds. Now, this picture is a picture of the 3 folds. Here you see vocal fold, vestibular fold, and epiglottic fold. This is epiglottic fold, this is a vestibular fold, and this is a vocal fold. These 3 folds very important. Right? Now, how this fold is formed? Now come to this picture. Here you see, this picture I have drawn here. It is very important picture. Here you see, after removing the lamina of the thyroid, you are seeing this. Now, this one is the cricoid cartilage, this is arytenoid cartilage, and it is the vertically cut part of the thyroid cartilage, right? Now here you see you have seen that the cricoid cartilage is attached to, just above the cricoid cartilage what lies? Above the cricoid cartilage what lies? Thyroid. So if they are joined by which membrane? Cricothyroid membrane. Midline, they are known as median cricothyroid ligament. Median cricothyroid ligament. Lateral portion, actually it is entering through the lower margin of the thyroid cartilage, and that is known as cricovocal membrane. By this term you can understand cricovocal membrane. That means upper part of this ligament or membrane will be thickened to form vocal cord. That's why it is known as cricovocal membrane. This cricovocal membrane, upper part thickened to form vocal ligament. When this vocal ligament will be covered by fold of mucous membrane, then it is known as vocal fold. Right? Likewise, another membrane is there, that is called quadrate membrane or quadrangular membrane. Quadrangular, that's why quadrate. That is, here you see, this part. This is more or less quadrangular. This is quadrate membrane. Quadrate membrane. If you describe the boundary, this part is the epiglottis, from the lateral margin epiglottis, anteriorly, and behind it is the thyroid cartilage. So this is the quadrate membrane. This quadrate membrane, this part, not this part, this part is quadrate membrane. Here you see, below it has been thickened to form, the vestibular ligament. When it will be covered by mucous membrane, it is called vestibular fold. Between these two folds, this area between the two folds, this. So between these two folds lies the cavity of the larynx. Laryngeal sinus. It is called laryngeal sinus between these two. বুঝতে পারলি laryngeal sinus কোনটা? উপরের পাটটা? ওটা quadrate membrane. উপরেটা তো inlet of larynx. ওটা তো inlet of larynx. ওই যে নিচে, here you see this. Here you see this part is laryngeal sinus বা ventricle of larynx. Above this is the quadrant membrane. Here is the cricovocal membrane. Its upper end has become thickened to form vocal fold, and this membrane, quadrant membrane's lower part has thickened to form vestibular ligament or vestibular ligament. When it will be covered by mucous membrane, then it is known as fold. The vocal fold and vestibular fold. Within the space lies the ventricle of larynx or sinus of larynx. Right? One important question you may be asked: when you will see the larynx by the laryngoscope, how it looks? These two fold, vestibular fold and vocal fold, how it looks? Vocal fold looks pearly white, and vestibular fold looks pink, and it is white. Why one is pink and another is white? Why? Because the vocal fold below the mucous membrane, there is no submucous coat in case of vocal fold, but in case of vestibular fold there is submucous layer which is vascular. That's why it looks pink. But as there is no vascular submucous layer within the vocal fold, so it looks white. So by this you can identify vocal fold and vestibular fold. Right? Now this vocal fold, as it does not contain any submucous layer, it does not contain any mucous gland here. It has got no mucous gland here, but we know for its proper functioning some lubrication is needed. Now from where that mucus comes? Now here you see this is the ventricle of larynx. From the ventricle of larynx, one mucous pouch goes deep to the vestibular fold, that is known as saccule of larynx. From that saccule of larynx, mucus comes and lubricates the vocal fold. That's why it is called whale can of larynx. Saccule of larynx, sometimes called whale can of larynx. Now come to the this is the epiglottic fold. Now if you are asked about the inlet of larynx, the boundary of the inlet of larynx is inlet of larynx. Here you see inlet of larynx is this portion. This portion is the inlet of larynx. Boundary of the inlet of larynx is the upper free margin of the epiglottis. Anteriorly, laterally is the epiglottic fold, and posteriorly interarytenoid fold of mucous membrane. This is the arytenoid process. Apex of the arytenoid. Here there is mucous membrane. So interarytenoid mucous fold. So this is the inlet of the larynx. Right? Inlet of larynx. Now the mucous fold where lies this is called epiglottic fold. Epiglottic fold, within this epiglottic fold lies two muscles, two cartilage. Two muscles, one muscle is that is the epiglotticus muscle. This muscle is known as the epiglotticus muscle. Another muscle is there. This muscle that is called, it is the thyroid cartilage, and the epiglottis, so thyroepiglotticus. So this muscle also lies here, thyroepiglotticus, and this is the epiglottis to this is from the arytenoid to epiglottis, so epiglotticus and thyroepiglotticus. These two muscles lies within the aryepiglottic fold, and there are two cartilages here, small cartilage, corniculate and cuneiform. So this actually forms the aryepiglottic fold. What is the function of the aryepiglottic fold? Aryepiglottic fold, when it will contract, it will close the inlet. When inlet is closed, when it is needed to close the inlet, at which time? At the time of swallowing. When you are swallowing, then aryepiglottic fold will approximate each other and will close the inlet, right? So this is the aryepiglottic fold. So we learned about three folds. One fold is above aryepiglottic fold that forms the boundary of the inlet of the larynx, and just below there is another fold, that is the vestibular fold. Within the space between the two vestibular folds is known as rima vestibuli. And just below, this is the vocal ligament of vocal fold. The space between two vocal folds is known rima glottidis. So rima glottidis, rima vestibuli, and inlet of the larynx. So this is the inside of the larynx, right? Now come to the applied importance. Sometimes explain why. Question comes as explain why. If after thyroid surgery, if hoarseness develops after thyroid surgery, then how will you explain? Bolo. After thyroid surgery, if hoarseness develops, how will you explain? Yeah?
Recurrent laryngeal nerve damage.
Very good. ठीक बोला आपने. ठीक बोला. You have right to say. Recurrent laryngeal nerve, right? Recurrent laryngeal nerve, if injured, then what will happen? Which muscle it supplies? All muscles supplies. So all muscles is supply except सामने एक मसल है, नाम क्या है? Cricoid से thyroid, cricothyroid. What is the? You have to know the function. Then you will be able to say if it is lost, this nerve supply lost, then what will happen? That muscle actually it tenses the vocal fold. But other muscles, if it is paralyzed, then the vocal fold will assume the position between abduction and adduction. That is called paramedian position. If unilaterally it is injured, some weeks later, patient again will regain his voice. How? Some weeks later, patient will be again normal voice will develop. How? Because at that time what happens, from the normal side, the vocal fold comes and compensates the action of the other side. Normal side compensates the action of the other side. That's why. But if both side is lost, then there will be no chance of compensation. Right? Then the paramedian position, both sides will take paramedian position, and what will happen if you do any strenuous job when much more oxygen is needed, through this gap it will not be able to supply. That's why you will need tracheostomy operation, right? So this is the explain why. The vocal fold is called watershed line. What do you mean by watershed line? What do you mean by watershed line? Actually, you have come across this term before, watershed line. What do you mean by that? Above, nerve supply, blood supply coming from different source, and below, nerve supply and blood supply coming from different source. That is called watershed line. Above the vocal fold, The nerve supply is, sensory supply is from internal laryngeal nerve, above vocal fold. Below vocal fold, sensory supply is coming from recurrent laryngeal nerve. Above the vocal fold, arterial supply is from superior laryngeal artery, and below the vocal fold, arterial supply is the inferior laryngeal artery. The lymph from the upper side will go to the pretracheal and jugular-digastric lymph node, and below vocal fold, lymph will pass to the paratracheal lymph node. That's why it is called watershed line. Sometimes it may come as a explain why it is called watershed. You have to write all these three things. তুই একটা ল্যারিংসের মাসের নাম বলবি নাকি? ল্যারিংসের মাসের দু একটা নাম বলবি? বল। আমি আগেই বলেছিলাম যে ক্লাসে বসে অন্তত 20%, 100% সম্ভব না, মানে ততটা ব্রেন নিতে পারবে না, কিন্তু 20% নেওয়া যায়। 20% ক্লাসেই পড়া করা যায় যদি খুব অ্যাটেনশন দিস। প্রত্যেকটা জিনিস তো নামগুলো তেমন কঠিন। অ্যারিটিনয়েড কার্টিলেজ নাম খুব কঠিন, ক্রিকয়েড কার্টিলেজ নাম কঠিন, তাহলে তার সাথে সব রিলেটেড। যখন মাসলগুলো বলছি একটা কার্টিলেজ থেকে আরেকটা কার্টিলেজ যাচ্ছে, তার সেই অনুযায়ী নাম হয়ে গেছে। তাহলে একটা মাসল 9টা মাসল আছে, 9 muscles. From this picture, you will able to identify this muscle. This is called, from it is arytenoid to epiglottis, the epiglotticus. This muscle known as epiglotticus, 1 number. This muscle it is oblique muscle of the arytenoid, oblique arytenoid muscle. From the muscular process to the apex of the arytenoid of the other side. So this is the oblique muscle of the arytenoid. Another muscle transversely oriented, that is from the posterior surface of the arytenoid to the other posterior of the arytenoid, the transverse arytenoid muscle. তাহলে এখানে 3টে হয়ে গেল, 1, 2, 3. This muscle is the most important muscle of the body, that is from cricoid to arytenoid, cricoarytenoid. That is posteriorly situated. It is called posterior cricoarytenoid muscle. It is the only muscle of the larynx which causes abduction of the vocal fold. So this is the, তাহলে 4টে মাসল এখানে হয়ে গেল। 4 muscles out of 9 muscles, 4 muscles এই পিকচার থেকে দেখা যাচ্ছে। This picture is actually transverse section through the rhizoglottitis. Here you count how many muscles are there. Number one, this muscle is the posterior cricoarytenoid muscle. This is the transverse muscle, 2. Oblique muscle, 3. This muscle is known as vocalis muscle, as it lies by the side of the vocal cord. 4. This is called, it is the thyroid cartilage, thyroid muscle. 5. This is the thyroid to epiglottis, thyroid epiglottis. 6. This is the lateral epiglottis, lateral cricoarytenoid. 7th. And 8, 9, and there are 2 muscles left. One is anteriorly, one muscle is right, cricothyroid, right? So there are total 9 muscles.